Can you hear me okay?
Spelled A-L-A-N.
Welcome. My name is Suzanne Beers. I'm the Chief Development Officer here at the Wills Eye Foundation. It's my pleasure to welcome you all today to our Ophthalmology All-Stars Lunch and Learn. Thank you all for being here. We're especially grateful to all of you, our close circle of benefactors, for your continued support of Wills Eye. Thank you. I also want to extend a special welcome to members of the Board of Directors of City Trusts. Thank you, Councilman Squilla, for being here, and Al Dandridge. We also have members of our Third Century Council, Zeph Lassinger in the back there. So thank you for all being here today. Programs like this are a wonderful opportunity to connect with all of you about the exciting work underway at Wills Eye, including our latest clinical and research advancements and the strategic priorities that are shaping our future. Your support makes this progress possible, and we're delighted to share the impact of your investment. Today, we are thrilled to hear from our Chief Executive Officer and Ophthalmologist-in-Chief, Dr. Julia Haller. If you haven't heard of her, I'm not sure where you've been. Just kidding. As you all know, Dr. Haller is not only an exceptional leader in ophthalmology, but also a visionary, guiding our extraordinary team of clinicians, scientists, and staff at Wills Eye. Her leadership continues to elevate the institution's national and global impact, and we can't wait to hear her talk this afternoon. Before she comes up here, just a brief note, we'll have time for questions at the end of her presentation, so please feel free to ask. And with that, we'll get started. So please join me in welcoming Dr. Julia Haller.
Thank you. Thank you so much, Suzanne. I'm so honored to be here. And I have to warn you that I got very excited when I thought about this talk and saw all the friends and supporters who are going to be here. And so it is really packed with a lot of information. So you may want to buckle your seatbelts. And I apologize if it's a little too much. Oh, I do have a couple of eye surgery videos. Is there anyone who feels that they might be squeamish about those? No? Okay, good. I'll warn you before I hit play on them. So I wanted to talk about a number of things today. I'm titling it Strategic Update, and it is framed a little bit based on feedback from our March 26th and March 27th 78th Annual Wills Eye Conference. This is an annual event that's sponsored by the Wills Eye Alumni Society. Our alumni come back. We have a big dinner dance. This year it was at the Constitution Center in honor of the 250th anniversary of our country. And there is a scientific conference. We invite a number of our alumni and friends who are distinguished scientists from all over the world. And we spend a day talking about interesting topics. Gene therapy was one of the topics this year. Our residents and fellows and students present their research papers, which is very inspiring. And it's a wonderful collegial time in general. These are some of the wonderful speakers we had. At the top is John Berglund, who's one of the top cataract and anterior segment surgeons in the country. Below that is Jesse Berry, who's doing incredibly innovative work in ocular oncology at LA Children's Hospital. And then Glenn Jaffe is at Duke and runs one of the seminal reading centers looking at ocular images from various clinical trials. John Berglund was here to speak on Wednesday and then stayed for the Thursday, Friday, Saturday event. And at dinner, he took me aside and plied me with questions about how Wills gets to be Wills. And his key question was, what is the Wills special sauce? What makes us who we are? And so that's something I've been thinking about a lot. And particularly in my new position, what I'm finding is there's so many wonderful opportunities out there that are coming to us all the time. And an important question is, how do we change, how do we grow, how do we evolve, and not lose our special sauce? And in order to make that possible, we have to figure out what is the special sauce. And I'll be interested in hearing from all of you all who have such deep experience with wills in so many different ways, what you think is the special sauce. I mean, one piece that's unusual is that we are the first eye hospital in this country, and now the only remaining independent eye hospital. As you know or may not know, in 1832, our Wills was formed. We were a gift to the city of Philadelphia from the Quaker merchant James Wills, who left his money to build this first eye hospital, which is over on Logan Circle. We're in our fourth one now, but I love this photo. Our early surgeons are some of the most famous people in early American medicine. This is actually from A History of Wills Eye Hospital. Here, for example, is Dr. Agnew, who was portrayed by Akins in this famous Akins clinic that's now at the Art Museum, and was one of the cataracts. So he brought his eye cases to Wills. He was a general surgeon, and in those days, general surgeons did eye surgery. It was in 1839 that the first surgeon came to Wills to be trained in ophthalmology as a specialty. So we also trained the first ophthalmologist in the United States. And since then, we have trained the most ophthalmologists of any program in the United States. So that's got to be part of our special sauce. But obviously, we can't just rest on our laurels. We have to pivot, we have to innovate, we have to change. We are proud to be continually ranked for all, I think it's 32 years that this particular poll has been out, in the top 2 or 3 best hospitals in the country. But it goes way beyond that. Our new organizational structure is 9 months old, so it's still in its, if not its infancy, it's early babyhood. And it's been a real honor for me here to take over as CEO. This is at a ribbon cutting ceremony we had not too long ago, and you can see some of the board of directors of City Trust here. Mayor Michael Nutter, two-term mayor of Philadelphia, is now chair of the board of City Trust. Here in the room we have Councilman Squilla, and some of the other members of the board. Chris Rapuano here. It was a cornea ribbon cutting ceremony. Executive Vice President Michael Allen is here today, and then Mark Bleacher has taken over as our Chief Medical Officer. One of our strategic objectives right off the bat was some reorganization of our finance department, and we were lucky to be able to attract as our interim CFO, Rebecca Reinhardt, who was controller of the City of Philadelphia, Chief Finance Officer of the City of Philadelphia, and then went on to be the CFO at Drexel. So experience in a major academic center with a medical school, and she's been a tremendous addition to the team. Our strategic objectives in finance are manifold. We have many balls in the air right now. One was to renegotiate all our payer contracts. There was some publicity in the paper that you may have seen in terms of how underpaid we've been, and we are proud that we've made huge strides. We have a tremendous advance in our Independence Blue Cross contract and other contracts that we're working on now, IBX being the major player in this market. We have also looked at all our vendor contracts and all our professional contracts, including with our anesthesia group, pictured here, and with all of the other groups that we work with, from Alcon and Glaukos to Iron Mountain, Bausch and Lomb. So that is in process in our budgeting. We also looked at our partnerships. Our academic affiliate now is Thomas Jefferson University. But as an independent eye hospital, we really view ourselves as the Switzerland of Philadelphia, if you will. And you'll see as I go on to talk a little bit about the cadence of our academic year, that we really partner with every single other academic university, and particularly the medical schools in town. Our ambulatory surgical network was really the first ambulatory surgical network. Ophthalmology was in the vanguard in developing ambulatory surgery. And one of our strategic objectives is to rethink that network. Where do we need to improve the existing centers? Where should we be growing? it's vital that we invest in people, and it's really the people here who make the place what it is. If I had to pick a strategic, that's a key element in the special sauce. We also want to optimize our training programs. I often say that our residency is at the beating heart of the Institute. It's the #1 or 2 ranked ophthalmology program in the country. And it has some new leadership. Here you see outside our eye emergency room with the first snow of the season. Dr. Chris Chung has been a wonderful program director for the residency. She's going to stay on in an advisory position. And Dr. J.P. Dunn, who heads our uveitis service, and Dr. Allison Watson will be taking over leadership. So that will be changing. We just had an educational retreat. But it's absolutely vital that in terms of our medical students, in terms of our residents, in terms of our fellows, and indeed in terms of continuing medical education, everyone in the world looks to Wills, and we need to continue to optimize our activity on that front. Obviously, research and being at the cutting edge of innovation is vital to our mission. I have here a few of the many wonderful clinician scientists who are doing incredible work, including Dr. Tatiana Millman in ophthalmic pathology. Dr. Millman and Dr. Eagle are a 1-2 punch team who are the very best ocular pathologists in the world. Just recently, a very dear friend of mine from college was discovered by them not to have the cancer with which he'd been diagnosed at one of the top institutions in the country. And he was literally getting his affairs in order, and he doesn't have cancer. So, that specialization, understanding at the cellular level what's happening in the eye, it's different from other places in the body, and it takes that level of expertise. Here's Dr. Zeba Syed on a cornea service, Ajay Kurian, who's working with not only Jefferson, but the Pennsylvania College of Optometry now on, and also the Osteopathic College on some really exciting work to try to delay scarring in recurrent retinal detachments. Here you see Dr. Joel Schumann doing an MSNBC interview. He is just stepping down from heading up the consortium at the National Eye Institute looking at ocular imaging, and particularly with big data set analyses and artificial intelligence. Joel is the one who years ago went over to the MIT engineers who were developing optical coherence tomography with a cow eye and said, I think this is the organ that might have the most applicability of this new technology. Those engineers won the Lasker Prize last year, but they wouldn't have if Joel hadn't given them that idea. And here we see Gadi Wolstein, who has, I think, 2 or 3 NIH grants, doing really exciting work on early glaucoma detection, including in monkeys, non-human primates. So when you look at the PubMed listing of all the papers that were peer-reviewed, this way underestimates because we do many more collaborative papers that this might not pick up. But you see 432 results for last year, published papers in the peer-reviewed literature from Wills, which means between 35, 40 papers are coming out at minimum every month from this place and are educating people all over the world about new innovative therapies. And that doesn't even count the book chapters and other types of publications. Another big strategic objective is community engagement. When James Wills gave his money to the city of Philadelphia, it was specifically for the indigent blind. So we, from our very inception, are dedicated to taking care of everyone in the community. And I'll be talking a little bit more in a minute about the diabetes screening program, which has now grown to involve all the other academic institutions in the city, as well as around the state. Give Kids Sight Day, which is one of the most meaningful, to me, days of the year, where we give out about 1,000 pairs of glasses. And recently, we've answered the call of the city of Philadelphia to serve the eye needs of juveniles who are lost without medical care in the justice system currently, hoping to be able to rehabilitate them visually so when they get back to their lives, they'll have a chance for education and success. So when we look long-term and short-term, we're looking at our administrative structure, our finance office, our academic affiliations, our network, including ambulatory surgical centers, offices, and then at growth and partnerships. And I can tell you we have many, many opportunities, and your wisdom is going to be something that we'd like to lean on too as we try to pick and choose wisely. We have some consultants with whom we're working. The national team of Huron is helping us on payer negotiations, our physician compensation and contracts alignment, and also executive leadership and strategy, and we've been very pleased with those. So, continuing with my theme of what is the Wills special sauce, I'd like to go through the cadence of the calendar with you all a little bit, and part of this is what I review with our alumni every year when they come back for the alumni meeting and Wills Eye Conference, and we talk about what happened this year. And I thought I'd share some of that with you too, because you get a little bit of a feel for the rhythm of the academic year, but it's also astounding how much happens. And it's also so illustrative of how much the gratitude of patients, the gratitude of the Wills Eye family, and their support has made a difference over the years. So this, rolling back the clock, here we were in 2025. This was our conference last year. Here were some of the wonderful scientists from all over the world who were our speakers on really interesting topics. Here were the named lectureships, and you see the physician program here. The named lectureships, all of these are named after famous Wills folks for many years and given by their families, their patients, and all of those who supported them. Next up was our inaugural Joseph Markoff Lecture, which was just about a year ago. Here's Dr. Ray Zdena. We've been trying to get our alumni back, particularly so our residents and fellows and trainees have an opportunity to see what is the trajectory. You know, when the residents are sitting in chairs listening to lectures in these rooms, how can they picture themselves in the future? Dr. Ray Zdena is head of the cornea service at the Mass Eye and Ear Infirmary and Harvard, wonderful alumnus, clinician, scholar. And Dr. Markoff, who is a wonderful graduate of Wills, gave this lecture for innovation and research. The Leibsons were honored with the Peter and Ruth Leibson Endowed Cornea Lectureship. There is also, of course, a chair in Dr. Leibson's honor, and Chris Rappuano is currently holding that chair as the chief of the cornea service. Jane Weiss from New Orleans gave that talk. This is the Wills Eye on Diabetes Day that I alluded to briefly when I talked about our community involvement. So Dr. Alan Ho had the original intent, and this was based on patients coming in. So blindness from diabetes is preventable, yet in this city alone, hundreds of thousands of people have undiagnosed diabetic eye disease. So Philadelphia is a particularly egregious example of where you have the best med ed in the world and the best, most innovative treatment and early adoption at one end of the spectrum. And at the other end of the spectrum, people who don't even know that there's a connection between their diabetes and their eye disease, who don't know that the eye is the organ number one most impacted by diabetes, who don't get diabetic screening, and who are going blind from diabetic retinopathy. So this effort is to try to combat that gross inequity. Dr. Ho's energy was leading it. Dr. Nellie Shields here was a medical student and helped him get this started. And here you can see some of the huge team of folks screening people on Diabetes Day. It's coming up next weekend. And here you see these two receiving the Humanitarian Award this year from the Pennsylvania Academy of Ophthalmology, because this effort has now rolled out not only citywide, so there is screening at Temple, screening at Penn, screening all across the city, but also at Geisinger, at Penn State, at Pitt. And there is some interest in our alumni for starting screening programs all around the country. Here's another wonderful event that is supporting research. Here's Dr. Jose Polito, one of the world's experts on inherited retinal diseases, and in fact, pretty much every disease of the eye. The man's a genius. It's no accident that he looks a little bit like Einstein. And he gave a wonderful talk at this Eyes on the Cure fundraising event where there was a surprise $100,000 check given for research into retinitis pigmentosa. Our Ophthalmology All-Stars event, this event, last year was held in June, and Dr. Jonathan Myers and Dr. Joel Schumann talked about advances in glaucoma. We then also in June had the annual golf outing, which supports various initiatives, including our children's initiatives, our global ophthalmology initiatives, with the arrow points to last year's winners. So there's Dr. Biren Makpara. Many of you may recognize Sid Tyson. These are, that's a wonderful event every year. Yeah, they're the winners were. In June, at the end of June every year, of course, is graduation, which is always a poignant event because you're sad to see everybody go. But you're so proud and you're so excited about their career trajectories. One of the nice things we do at graduation that the Luo family allowed us to do is to present a distinguished service award to members of the class. And here you see Leo Hall and Martin Colati, and also over to getting these awards for their class. And Hannah Garrigan over here getting the Gold Award. Katie Gold was a former resident, and this is given to the senior who's done the most for Wills. There is the resident class of 2025. We get over 600 applications for 8 spots. So if you can imagine the work the residency selection committee does to cull through all of those applications. Ophthalmology is one of the hardest specialties to get into. And we put a lot of time and effort into understanding who each of these people is and trying to build a team that will really flourish here. This, so out with the old, in with the new, in comes our incoming class. This is the bright-eyed class of 2028, of which we're very proud of, the first-year residents. So in ophthalmology, you do an internship, general internship year, and which has 3 months of ophthalmology rotation. So general medicine, 3 months of ophthalmology, and then you go into a 3-year program in ophthalmology itself, and then many people go on to 1- and 2-year fellowships if they're specializing, for example, in retina, glaucoma, oculoplastics, or others. It was in July and August that we had our leadership transition, and this is the leadership reception pictured here in September. Here you see Mayor Nutter giving his talk, where he told, so we had a lot of people here, including a lot of the folks who work at Wills, back office people, technicians, people who check people in. And he told a story that I somehow had never heard. I don't know if you all have heard it, about when President Kennedy visited Cape Canaveral as president. And of course, his big talk, he talked about the moonshot in his inaugural address about sending a man to the moon. And he spoke with the scientists and the engineers, and he inspected all the work that was being done. And then he saw a janitor over in the corner with a broom and went over to the janitor and said, "Hello, I'm President Kennedy. Can you tell me your name and what you do?" And the janitor said his name, and he said, "I'm here helping to put a man on the moon." And so Mayor Nutter looked around the room and said, "And that's what you're all here for." And I was like, yes. It was such a great story. Really loved it. In September, we had the Bausch & Lomb team. Bausch & Lomb, of course, one of the big companies in ophthalmology. Their leadership team decided that for their day of giving, they would come to Wills and help us get ready for our big Give Kids Sight Day. Give Kids Sight Day is when we open up the hospital to any children, regardless of what funding they have, to come and have eye screening. And get their eyes screened, and they get glasses. We figure out if they've got a problem. If they do have a problem, they're given appointments to come back. We have social workers helping them navigate insurance, get into the CHIPS program. We have translators who speak, I think, 19 different languages. And it is a totally exhausting day, but it is so rewarding. And here you see them packing up the little swag bags that had crayons and coloring books and things like this, because it's pretty hectic. Here you see Give Kids Sight Day itself on October 4th. We have volunteers from medical schools, from sororities and fraternities, colleges all over. And here you see the children getting their eyes checked. Here you see them actually getting, if their vision is not good, then they are checked for glasses. Here they are trying on some glasses to see if and their glasses are ordered. We give them 2 pairs of glasses because what we've discovered is you need a pair of glasses at home and a pair of glasses at school for them really to be effective. And if glasses alone don't work, then they're given appointments to come see us. Soon after that, we all went to Orlando for the American Academy of Ophthalmology meeting. And Wills has huge presence at this meeting. This year, Dr. Chris Rapuano is actually president of the American Academy of Ophthalmology. Last year's president is pictured here. This is Mike Repka, now at Hopkins. He's a Wills graduate. Next year's president, Stephanie Marino-Jones from Virginia, is also a Wills graduate. So we have a trifecta here of Wills graduates, which gives you a little sense of the leadership which we try to instill as part of their responsibility when they go out into the world. This is our booth at which Jack Scully, who's showing my photos right now, my slides right now, runs with his team. And here you can see the small, this is like a little, it's a huge exhibition floor, but our booth has chairs and a screen, and people it's so noisy. So they wear special earphones, and we give lectures. So these are highlighted lectures by all-star faculty members. And there I am, that one. Here you can see from the back what it looks like, and you get a feel for how huge the space itself is. Here's Dr. Brandon Ayers giving a talk. And one of the things we innovated this year was that for medical students and other young folks thinking about going into ophthalmology, we had our residents who were giving talks at the academy come and meet with them, and that was a very popular highlight. When we came back from the academy, our alumnus John Cropsey gave us a report on his work in Rwanda. John is an extraordinary young man who grew up as the son of a missionary surgeon in Africa and determined that he indeed wanted to grow up, become a physician, and go back to Africa, and he did. And here he is with his wife and children in Rwanda. He is an amazing person who won the first Artemis Award that the American Academy of Ophthalmology gave a few years ago for humanitarianism and worldwide global impact. And he comes back every year and has helped with programs that our own residents have going around the world and experiencing global ophthalmology. And of course, many of them make that a part of their lives forever. We order all the glasses on Give Kids Sight Day. They pick them up a few weeks later, and that's a really fun time too. You see how excited they are. You see these adorable kids. And what we've discovered is 2 out of 10 kids that we screen. These are children who have not benefited from any other medical services in Philadelphia. 2 out of 10 of them can't see the board at school. And imagine what a difference we're making in terms of impacting on these young people's lives. And we've actually taken some subsets of these and with our social workers tracked their academic work and shown how much it improves with the addition of glasses, no surprise. In November, we had the Edward Jager Award. Dr. Jager is one of our most beloved physicians here, and he's pictured in the portrait on the left in the back of the room. He taught the medical students and captained the ship for their process of applying into ophthalmology, and then was kind of a godfather to the residents for about 35 years. And when he died, his family gave this lectureship, and we've made it into an educational lectureship, and we've tried to invite our alumni who've taken non-traditional paths to come and talk about their experience, what they've been able to do. This is Gil Kleiman, who you see here, who has gone on to be a venture capitalist, has funded some of the major innovations in ophthalmology, including the company Glaukos, which I'll be talking about in just a minute. And so very interesting for him to talk about entrepreneurship and his personal track through life. So remember my recurring theme, I'll keep putting this slide up. One of our special sauce pieces, I think, is that it's the spirit of the place. You know, there really is a Wills Eye family. People really do come back. We had a wonderful Wills Eye Ball. We work hard, but we also like to play hard. And we had the mummers. And we honored the CEO of Glaukos, which is a company that developed the first minimally invasive glaucoma technology. And I'll talk about that in a little bit, or I might get Lou Schwartz up to talk about it, because he brought the first laser for glaucoma into this country in the glaucoma service. The glaucoma service is truly one of the jewels in the crown of Wills Eye Hospital. Our former glaucoma service chief, Jay Katz, is the chief medical officer for Glaukos. And here's John Myers, who's chief of the glaucoma service. And this ball benefited the glaucoma service chair. We also, at the party, announced a multi-million-dollar gift to establish the Anderson Strategic Initiatives Endowment Fund. And here you see Jim and Sue Anderson at the eyeball accepting a little gift in their honor. And here are our residents and fellows, and I think you get a feel for the joie de vivre that personifies this part of the residency. Of course, there's some very hard work too. Here's a compendium of visiting professors and special lecturers. I think I've already given you individual lectureships, but you get a feel for the breadth of academic exposure that our trainees get. Our aim is for them to hear from some of the brightest minds in the world so that they can be inspired and that it will help them as they navigate their career trajectories. As you may know, in medicine, medical students apply for residencies. The residencies evaluate them. Everybody makes a computer list of their top choices, and then it's fed into a computer in San Francisco, and you come up with the match. And so here, one of the big events of our year, in the early part of the year, it's usually late January, early February, is the match. And here's the class of 2030 that we have going forward, and we're very excited about this group. Also in January, we had the cornea service ribbon cutting. You know, this building is only 25 years old, but it gets a lot of use. And so very important for us to keep renovating. This cornea service renovation was in part sponsored by an RCAP grant, as well as donors, the Grays, the Lawrences, and the Harns family. And here again, you see members of the board of directors of City Trust cutting the ribbon. Here's one of the new diagnostic rooms made possible by this. This is Dr. Rapalano's new office, which, believe me, is much more spacious than his old office. And here's some of the facility looking very empty. Dr. Zayed has told me last week that she saw her normal number of patients, which normally would have taken her all day, by 1 o'clock. So it shows how much this is going to increase our ability to see more patients and meet more needs. This is an exciting thing that our global ophthalmology group started doing during the pandemic when they couldn't travel around the world, and that was to look in Philadelphia at global parts of Philadelphia, underserved places where refugees are. And it turns out Philadelphia has a huge refugee community, many people in need of care and with lack of access. The Weiss Access Clinic was started to serve that population by Jefferson some years ago. We opened up an ophthalmology division down there and and see patients for free. And it's at special days, for example, Martin Luther King Day, rather than having lectures and thinking about Martin Luther King, we actually put that spirit into action and take those patients who need surgery. Our vendors help give us free lens implants and other things, and we do surgery on those patients with limited access to care. And I think that's part of the Will's special sauce too. A huge part of the special sauce is our collaborative work with everybody who will help us and who would be a good partner, and that's in Philadelphia and all around the world. This is something that we were really excited about this year, and I have to give credit to Joel Schumann, organized this from our glaucoma service. It was the inaugural All Philadelphia Glaucoma Research Retreat. Many of you may recognize the College of Physicians of Philadelphia in these pictures. The nation's first medical society started in 1787. And at the college, Joel brought together researchers from you see all of these different institutions in Philadelphia to present their research and to have collaborative discussions. And very excitingly, a number of collaborative new initiatives have grown out of that meeting. And we look forward to continuing this type of collaborative effort. And hopefully some of these pilot projects will result in fundable research from the NIH and other institutions. Here you see the faculty. There were also poster sessions where our medical students, residents, and fellows had posters. It was really an incredible 2 days. Another thing we've been working on is formally putting together an advisory group here. Of course, the leadership at Wills, the governorship, we're governed by the board of directors of City Trust, which is in charge, which oversees all of the trusts of the city of Philadelphia, of which we are one of the largest. We're looking to build a board of ambassadors who are interested in supporting us as well as our regular board. So sort of what we're calling the Third Century Council, because of course in 2032 it'll be 200 years. So looking forward to our third century. And last year we host these high-level volunteers and donors, and we look forward to growing this group and working with them to help advise us as we move forward, and particularly help us with strategic planning. And I'm looking around this room. Anyone who's interested in joining this group, please let me know. In all seriousness, this is exactly the group of folks that we are looking to. People who understand what we're all about and who support us and want to help us. A big part of the Will special sauce, and I've alluded to this earlier, is the research that comes out of this place and the teaching that comes out of that research. So here are some of the publications and high-impact journals that we saw from March of last year to March of this year. Again, 35 to 40 papers coming out month after month. This is just a quick taste of some of the scientific conferences where Will's clinicians were presenting papers, presenting their research, presenting their new techniques, innovations in surgery and care of patients in every specialty and in many corners of the world. Every year, Dr. Ralph Eagle captains the ship for an annual review course, and this is for folks who are getting recertified in ophthalmology. In ophthalmology, you have to get recertified every few years. And also for residents and fellows who are reviewing ophthalmology because they're about to take their boards. This is the oldest review course in the country. It's our 51st annual one. It's in this very room. You can see it's set up a little bit differently. But that, again, is one of the ways that we help educate people, bring the practice of ophthalmology up to speed in so many different ways. Also, in this room, we're set up for streaming around the world, and we have a number of different conferences. The chairman of ophthalmology, the former chairman of ophthalmology at Johns Hopkins, Mort Goldberg, who still is a lifelong learner, told me that he actually spends more time at Wills than he does at Wilmer at Hopkins anymore, because he comes to all our conferences virtually from his home. So if you look at last year at our Chiefs rounds, which we had this morning at 7 a.m., We had over 4,000 people. There are several of our alumni in India all get together at whatever time it is in India, 5 o'clock or whatever, and attend from there. So we know all around the world people are watching. Retinal imaging, retinal surgery, our visiting professor talks. Tomorrow we have a Saturday update. If anyone wants to come, it's a retina update. And then the research conferences. So we have huge global impact virtually as well as in person. Here's the photo of one of our Saturday updates, wonderful speakers, wonderful faculty members. And these are updates just in the morning on Saturday, really efficient use of clinicians' time, very clinically oriented talks, bringing in new techniques, bringing in new information, having panel discussions and answering questions with case presentations. What would you do about this patient? What would you do about that patient? Lots of news in the last year. These are our press releases over the last year, some of which you may see. And these tout various things. You know, for example, The Ophthalmologist is a global journal that's from London. This is everybody at Wills who's recognized on their so-called power list. I'm really not a fan of these polls, but, you know, I'm grateful we're at the top of them. Here you see the Castle Connolly top doctors list. Wills has the most ophthalmologists on the best doctors list by Castle Connolly of any hospital in the United States, and that is doubtless part of our special sauce. According to Sir William Osler, who is arguably the greatest physician outside maybe Hippocrates who's ever lived, the most influential, the secret of success for an institution is to blend the old with the new, the past with the present in due proportion. My buddy ChatGPT translated this to, he believed in marrying tradition with innovation, ensuring that institutions maintain foundational values while adapting to change, thus fostering continuity and growth. So I think that might be part of the special sauce. I'll put that out there. Here's an article that I liked. This looked at the academic benchmark of highly influential ophthalmologists listed in the Ophthalmology Power List. This paper asked, what does it take to become a worldwide influential figure in the field of ophthalmology today? And what they found was that they looked at everybody on the Ophthalmology Power List, that's how they picked them. They had done their residencies either at Wills Eye Hospital or Mass Eye and Ear. Those were the top two. And their fellowships at either, now note similarity in two of these lists, at Wills Eye Hospital, Bascom Palmer, or Wilmer. So they said, to the best of our knowledge, this is the first international survey that focuses on the question, what does it take to become a worldwide influential figure in the field of ophthalmology today? And the answer is, train at Wills Eye Hospital. And indeed, I think our residents and our residency products are a key part of our special sauce. When you look at outcomes, you can measure it in a number of different ways, but I would put the trifecta leading the American Academy of Ophthalmology last year, this year, and next year as an outcome of which we can be very proud. I might note that Dr. Rapuano took to the board meeting of the Academy Wills Eye sunglasses 2 weeks ago and sent me this picture. There are Wills Eye sunglasses available for all of you all. And here you see the board of the Academy all wearing them. I'm nearing the end, but I did want to tie into the revolution, 250 years, Philadelphia, but also how that's reflected in the revolutionary times we've seen in ophthalmology in the last 10 or 20 years, where it has really transformed medicine as we know it. It's introduced lasers. Lou Schwartz introduced lasers in ophthalmology in this country for glaucoma. It's minimally invasive surgery, outpatient surgery, ambulatory surgical networks, and all the way to gene therapy. Gene therapy, the first gene therapy in humans, introduced in the eye in this city at Children's Hospital. I was honored to be one of the 3 surgeons in that trial. I think the revolution of the last 20 years is due to a number of things. One is we've got better technology to diagnose and understand what we're treating. This is an example of an optical coherence tomography cross-section of the back of someone's eye This is the technology that Joel Schumann envisioned when he took the cow eye across the river to the MIT engineers all those years ago and said, I think the technology you're developing might work for us. That's made a huge difference. Different types of OCT angiography are seen here. Here you see somebody with Alzheimer's disease losing in the blue, getting atrophy over time, and this is one of the very exciting areas where the eye-brain interface may give us many clues that help us develop new treatments for neurological degenerations. As well, new types of pharmacologic innovations have come out. Many of you know people who are getting injections in their eyes for treatments. Injections in the eyes weren't even thought to be a possibility up until the early 2000s. So epidemiology and genetics, of course, informing many, many things that we do. And I showed you a picture of Dr. Polito, who looked like Einstein, and he's an expert in that, amongst other things. One of our big innovations here was to build the MESI Ophthalmic Surgical Training Laboratory with a gift from the MESI Foundation a few years ago. This is the best wet lab in the country, available for training residents, medical students. We get medical students in to try to inspire them. And it's open right now, and if you'd like to take a tour of it, I thought it might be fun for you to see on your way out. But here you see, first of all, you see how intense our students are. Second, and residents, this is a resident. Second, you see how intense our faculty is. This is actually a drug rep who's here showing showing some of the new equipment. This is a junior faculty person. This has been hugely impactful, and again shows our tremendous commitment to education and innovation. And it's used by practicing physicians too. Why is that? Well, because new types of treatment and technology are coming out all the time, and I just want to talk about 3 of them very quickly to orient you to what you're going to be looking at. And this is where I'm getting into the part where if you're squeamish, let me know, because I'll be showing some eye surgery. But just to orient you to the eye, here's the cornea in the front. The anterior chamber angle here is the drainage channel where fluid flows out of the eye. It's being produced and flowing out all the time. And glaucoma specialists know all about this area because it's the one where if drainage is not adequately fast, pressure builds up and you develop glaucoma. So I'm going to be showing you a new type of minimally invasive glaucoma surgery where a tiny little shunt is put in here. Instead of the operations that we still do, but that are much more maximally invasive, where a full thickness opening is made here or an actual larger tube is put in here that shunts to a drainage valve down here on the side of the eye. So that's going to be one procedure that you're going to see. You're also going to see a procedure where we go back into the retina, and here's the macula. So here's the retina in the back of the eye, the film in the camera. The macula is the bullseye of central vision. You're going to see somebody with macular degeneration who's developed a hemorrhage here, blocking out all their central vision. And you're going to see us feeding a 41 gauge cannula. This is the size of a few strands of hair, and injecting clot-busting material into the clot to dissolve it, and then putting a gas bubble in to push the dissolved clot out of the central vision. And finally, you're going to see something hot off the presses, which is a little implant that is sutured here into the back of the eye, into the anterior part of the back of the eye, which has just been FDA approved. It releases a special neurotrophic factor that helps rescue the macula in a certain condition called macular telangiectasia, where there's a neurological and vascular degeneration of the macula with visual loss. So this is an exciting new, recently FDA-approved treatment. And these are the sorts of things that we practice in this lab when they come out, because these weren't invented when I was a resident, for example. So here is a picture of the eye. We're looking, and I'll show you another picture in a minute, but this is a fundus photo looking through the pupil at the back of the eye. Can you see this kind of reddish purplish clot here? Here's the optic nerve. This is the macula. So that's obscuring all of this patient's central vision. Here is the eye. This is a vitrectomy. So these are minimally invasive 25 gauge cannulas. There you can see the blood. There's a teeny little 41 gauge cannula being put in, and it's being gently inserted underneath the retina. By the way, injecting something under the retina was not even thought of until about 2010. Nobody ever would invade the subretinal space if they didn't have to. And you can see the cannula is pushing a little bit. See the fluid ballooning up around the clot? And here you can see the liquid tissue plasminogen activator. This is the clot busting agent. It's used in strokes too. See how this bleb of tissue plasminogen activator is being injected under the retina to dissolve the clot. Okay, so that's injected. And then after that's injected, a gas bubble is then put into the eye, which reabsorbs into the patient's bloodstream over the next few days to weeks. And then that gas bubble, the patient is then positioned down, and the gas bubble pushes the liquefied clot out of the way. Let's go. So here is the pre-op photo with this clot. And here you see the post-op photo 2 days later. And there's a bubble up here, but you can see that the blood has been pushed out of the center. Now, it still has to completely reabsorb, but it's in the periphery now where it's not obstructing central vision. Here, we're going to talk about minimally invasive glaucoma surgery. So these little shunts were developed by Glaukos, and you saw that we were honoring the CEO earlier. These don't look minimally invasive in this picture. They look like major, huge tanks, but here is the size on a penny. And these are implanted in the anterior chamber angle. So here's Dr. Reza Zinajad putting a special lens on that has a mirror so that you can see the anterior chamber angle. And then can you see the teeny little stent that he's putting in here with these forceps, special forceps that hold the teeny little stent? And there he's got another one. He's putting 2 stents in this eye because he thinks the patient needs extra drainage. So this patient now has these 2 teeny little extra drainage channels out of which the aqueous humor can flow, lowering the pressure in the eye and hopefully curing their glaucoma. Here is the final one, and this is the hot off the presses new implant. This is the patient with macular telangiectasia. You're used to looking at pictures of the retina now. Here's the optic nerve. This is the left eye. And I don't know how well you can see, but there are these little yellowish spots here. This is protein and fluid. Here's some pigment scarring that has leaked out in this patient who has macular telangiectasia, a congenital genetic abnormality of the eye. And this protein and fluid leaking into the macula blurs their vision. And then when they start getting this secondary scarring, that wipes out that area of central vision. A company called Neurotech developed this new implant called Incelto that was just FDA approved. Here is the implant. It has a little strut here that has to be sutured into the wall of the eye. This is the high-tech capsule that has cells inside. These are actually retinal pigment epithelial cells. And there's a porous coating on this that allows oxygen and essential nutrients to flow in to keep these cells alive. But the cells are genetically engineered to make ciliary neurotrophic factor, which is a protective factor, and that protein, those are proteins that are therapeutic, and they are allowed to flow out through this special permeable coating that's on this chamber. And the proteins are depicted here, those little dots. And here is, again, another depiction, now sutured, can you see the little suture right there, to the wall of the eye, just in front of the retina, under a little flap. And we just had a course here, we've had 2 courses here on how to make sure people are trained on putting these in, because you have to be trained before you're allowed to do it. And we are the first in the area to now, I think, have implanted 2 or 3 of these, the first since the FDA approval of this particular device. I've got a patient who's waiting for this who's a PA in New Jersey, and you can imagine, looking at scans, looking at charts. She's got it in both eyes. This is going to be tremendously helpful for her. So that's part of the Wills special sauce too, that commitment. Finally, I'd like to talk a little bit more about how collaborative we are, and there's no better example of that than our ocular oncology service. Dr. Carol Shields is the chief of that service. This service is the largest in the world and the most famous. This service sees 25% of all the ocular tumors in the United States of America. I'm talking in this particular couple of slides about one part of what they do, which is their work with children with retinoblastoma, which you may have heard of. Often the children are discovered to have retinoblastoma by their parents when they look at photos of their babies. Note that this child has a normal right pupil, but the left pupil looks white, and that's because of the retinoblastoma tumor growing in this eye. The tumor will not only destroy all the vision, but it will also destroy the eye, and it will ultimately kill the children. So obviously this is, one of the most serious things that we treat, and it's one of our biggest success stories. Every week between 4 and 5 children in the United States will be born with a retinoblastoma. 2 or 3 of those will come to Wills. So we have a huge practice in this particular disease. No child has been lost here since 1982. So very successful in terms of identifying and treating these tumors. Previously, though, often the treatment was removal of the eye, particularly if the tumor was large enough. Smaller tumors can be treated with lasers. They can be treated with radiotherapy. We pioneered the treatment of a plaque of radiation seeds that could be sutured to the wall of the eye and locally destroy a tumor. But these very large tumors, as in this child, mostly filling the eye, have been very difficult to treat. We partner with the Children's Hospital of Philadelphia on chemotherapy for these children if there's a risk of metastatic disease. This is Dr. Anne-Marie Leahy, incredibly committed pediatric oncologist with whom we work. And in particular also with the group of interventional neurosurgeons at Jefferson. This is Dr. Pascal Jabbour, who is a physical genius and amazing in what he's able to do. And we are one of the 2 largest centers in the world now for what's called intra-arterial chemotherapy for retinoblastoma. This is where a child like this, who has such a large tumor that in the past the eye would have to be removed. And remember, some of these children with genetic defects will have it in both eyes. So previously both eyes would have to be removed. And I should have put a picture of the Ronald McDonald House in here. 5% of the patients at the Ronald McDonald House, which hosts families free of charge who are in Philadelphia for children having various medical conditions, they've been wonderful for our patients for many, many years. That's been a wonderful partnership too. The new treatment, the intra-arterial chemotherapy, feeds a catheter, and originally it was a catheter from the groin. Now they've switched to a catheter from the wrist because pressure can be applied and the child can be awakened from anesthesia now, and the balloon pressure can be held for an hour or 2. Previously, they had to keep them under anesthesia because they had to have pressure on their groin. So that's been a big advance too. But the catheter is fed all the way up through the great vessels into the head. And here you see the internal carotid artery. Here you see the ophthalmic artery branch. This little branch feeds all of the blood vessels in the eye. The catheter, this shows the fluoroscopic visualization of the catheter. Here's the catheter. They inject a little dye, and it shows, yes, indeed, we are in the ophthalmic artery. And they then inject a big dose of chemotherapy that at that concentration would kill the child if administered systemically. So they couldn't just give it intravenously. But if it's just given in the eye, it kills the tumor but doesn't do damage to the rest of the body. And that has revolutionized treatment for this. Now, Dr. Jabbour gave me this video, which is on fast forward. He just likes to show these things. There he is putting the catheter in. This is hard to follow, but I thought you'd enjoy seeing it. This is back when they did it in the groin. Now, there's a teeny little catheter they feed up there, and it has a wire to guide it. He doesn't use the wire. I mean, everybody else in the world uses the wire. and they park the wire up here in the great vessels where it can do some damage. He doesn't use it. By feel, he goes up here. Here's the catheter. Oops. I love this video. By feel, and he also doesn't want to subject the child to too much radiation. And so he only takes a few pictures fluoroscopically as he goes up. He just knows. He knows by twisting and turning and feeling and how much length he's still got, that he's in the right, and then he can fluoroscopically see. He told me there's the tip of this very flexible catheter goes boom, and it goes into the ophthalmic artery. There it is going up through you can see the chest of the child. Here it is going up into the internal carotid artery, and then it's going to go up into the ophthalmic artery. It makes a little curve. There it is. See the curve? And now he's going to inject a little dye to make sure that he's in the right place. There he is. So you can see it lighting up, and it's lighting up the eye. Now he's getting the chemotherapy, and then he injects that. Here they are monitoring the child. Now they're putting pressure on it. It's all over. So here we see some results. Here's the back of the eye with a large endophytic tumor. Here it is after treatment. Here's another eye with vitreous seeding. Here it is after treatment. And this picture, I think, really shows it all. This is a child with a congenital inherited retinoblastoma, and this is the mother. So the mother had one eye enucleated, the worst eye. The other eye, they did external beam radiotherapy, which was the only way you could save the eye. It was less involved, which of course affected the whole development of her face. Like none of the bones developed normally. So she got a facial deformity. The radiation also, unfortunately, the side effect is it destroys some of the retina, although she still has some vision. It also causes the cataract, it causes dry eye. The vision loss is due to retinal atrophy. And in this form of bilateral retinoblastoma, you very often have a second cancer. So she also had to be treated for a second cancer. She had this adorable little girl born with the same condition who was treated at CHOP with chemotherapy, so she didn't develop a second cancer, and with intraarterial chemotherapy. And here you see her with all the vision that's left in these eyes, retaining the eyes, and a healthy little girl. So this is one of my favorite pictures. I think it says so much about how far we've come. So, that's part of the Will special sauce too. And I think if I had to pick one thing that really epitomizes what we do and why we are the greatest place in the world, it's because we keep the patient at the center of all our decision making, and that's our North Star. What is the best thing for the patient, and how can we optimize treatment for the patients of today, but also envision the treatment of patients in the future and train the folks that need to take care of those patients. In summary then, we are so proud to have been collegial, innovative, collaborative, and to have led our profession in so many ways. And it's through diligence and investigations, hard work, determination, and I think really essentially also empathy. Thank you very much. You can take off your seatbelts now. I know that was a lot, but does anybody have any questions? Or, we can also adjourn and just chat. Yes, Barbara?
Is there any reason that the residency program is limited to 8 people? Can it be expanded?
Good question. CMS has regulatory spots that it gives, and it pays hospitals for the training of those residents because they are value added, and those are the ones that we have. We are actively considering ways of increasing the number of residency slots because we do have work for them. There's plenty to do here. It is, I go all over the country and all over the world. It's the busiest residency in the country, and what folks tell me is that when somebody who was at Proctor Foundation, which is at the part of UCSF that does inflammatory diseases. He said they used to just pray that their lucky stars would give them a Wills Fellow, because they would get great fellows, smart people from other programs, but it would take a month or 2 or 3 to get them up to speed clinically. They knew that if they got a Wills Fellow, they were going to hit the ground running on day one. So I agree. Our alumni feel that way too. We'll get you to go be one of our speakers if there's a hearing. Anything else? Thank you all for your support. We really couldn't do it without you. Thank you.